Good day. We are the Ben and Bess. We are going to present our study entitled Assessment of Health Hazards Waste Management in Households of Bataan during COVID-19 pandemic, challenges, barriers, and opportunities.
COVID-19 outbreak and waste management system designed for moderate variants could now function abnormally due to drastic changes in quantum and waste efficiency. As the risk of cross-contamination is extremely high, disposable mass and other related household-derived material must be treated, disinfected, and disposed of in patient cells in sanitary landfills in compliance with the regulations laid down by the Department of Environment and Natural Resources and the Department of Health. The main problem of this study is the proper waste management system during and post-pandemic. Here in the province of Bataan, the current 10-year solid waste management plan, effective 2018 to 2027, does not include the proper management of special and hazardous waste, which is undeniably important due to COVID-19 crisis. Objectives. The main purpose of this research is to better understand the urgency of the situation the pandemic has brought in the waste management system of Bataan by generating data about the level of hazardous waste the province has and encourage the introduction of new efficient waste management for the hazardous materials generated from each household in Bataan during and after the pandemic through policy recommendation. The significance. The findings can be highly significant and beneficial, specifically to the following. First, knowing the level of hazardous waste used in household of Bataan provides realistic suggestions and explanations on how to cope with conditions in desperate circumstances triggered by the latest COVID-19 pandemic regarding waste management, and to give awareness and proper knowledge to the public about proper management of the hazardous waste. And also, the result of this paper may also be used as reference for future use, and to encourage a new framework and structure overhaul for waste management system in Bataan.
This is the tabulation of data for the challenges, barriers, and opportunity the Bataan province is currently experiencing due to pandemic. Challenges. Bataan does not provide hazardous waste management for each household. A new system adjustment can take time and money. A lot of medical waste will be produced due to the hospital at home settings. People lack awareness of things that are used daily can also be classified as hazardous waste. Sudden surge in demands of protective equipment such as masks, gloves, tissues, PPE, and face shields and sorts. Barriers. The only preventive caution our province required for the sanitary workers are the mandatory wearing of face masks and shield during their collection. Waste management industries must have the knowledge and information to keep the cleanliness and healthy environment. Single-use plastic are coming back at this time, also with health-related waste that might be infectious. The safety of the people handling the waste. Opportunities. An opportunity to review the current 10-year SWM policy of Bataan can bring opportunities for proper awareness in the right waste management. Proper segregation of waste, including hazardous waste, can be practiced over time. Opens a better and prepared system for future situations unlike the pandemic. Can be used as reference for future researchers.
Methods and materials. This chapter covers an overview of the research consisting of the policy analysis regarding hazardous waste management. It contains the generated survey to understand the level of hazard waste the province has, the data collection, data processing, and analysis timeline and other information used to conduct the project in Bataan during the pandemic. The data shown can help in developing new policies and improvement in the current waste management program of the province. Note that there is no existing data about the hazardous waste generated in Bataan, thus making the collection data from the survey efforts. Population. Based on the 2015 census of population, the province, 11 municipalities, and one component city had for the year 2015 a total population of 760,650. Policies: the 237 barangays in province had solid waste management committees which act as a multi-stakeholder arm of the city or municipalities in the implementation of SWM activities at the barangay level. Data collection. Survey questionnaire was conducted within citizens in each municipality of Bataan relating to the current condition of hazardous waste management before and during the pandemic. The respondents totaled up to 398, but this project only selected 220 of the response, 15 to 20 responses for municipality. Data processing. Survey questionnaires was conducted within citizens in each municipality of Bataan.
Results and discussions. The demographic profile of the respondents in the study are from 1st and 2nd District of Bataan. The total collected numbers of respondents are 220. The descriptive analysis of the data shows the frequency and percentage of the respondent depending on the qualitative question that was asked. The data on the descriptive table for question 1 shows the kind of face mask that the respondents use daily during the pandemic. It is incredibly important to know the majority of the kinds of face masks used daily, and as the data shows. This means that there are more wasted and used face masks thrown than being washed and reused. The table for question 2 was about how many disposable masks each household used per week, and 91 respondents said that they use 10 or more each week. 39 respondents use at least 1 to 5 disposable masks, and 71 respondents 6 per week. Only a frequency of 19 said that they do not use disposable masks. And the table for question 3 represents the number of times a disposable mask is used before throwing it into the trash. 41.8%, which got the highest percentage, responded that they at least use the disposable mask before throwing. This table for question 4 shows that most of the respondents, which frequented 79 and got 35.9%, said that they at least reuse the reusable face mask like cloth mask before washing it. The table for question 5 presents that 216 out of 220 or 98.2% of the total were using face shields. Based on the table 6, most of the face shields used are reusable and can be used from one time up to weeks before disposing. Table 7 shows that 86.8% of the total respondents said that they have no proper management of hazardous waste and most likely that their waste is just thrown with other household waste. The table for question 8 shows that 94.1% of barangay does not include a policy for hazardous waste during the pandemic. And the table for question 9 are additional information on other waste that is generated in our households. Most people are unaware of the classification of hazardous waste, thus being surprised that even a tissue paper could be considered as one.
Conclusion: the result of the survey has shown that most of the respondents said that they've used either disposable or reusable face masks, face shield, and sorts of protective equipment during the pandemic, and most, or 94.1% to be precise, have said that there is no proper collection, disposal, or management policies of their hazard waste in their respective barangays. The generated data above are significant since it is the first gathered data to be collected regarding the province's hazardous waste. Most of the result discusses the percentage of the generated waste during the pandemic that needs an urgent attention. All the results can be used as the reference and guidelines for selected municipalities to improve and come up with realistic solutions for a better hazardous waste management. With the situation happening around the world, it is not advisable that the medical and other hazardous waste to be thrown along with the other household waste. Since cross-contamination is highly likely to happen since the virus can stay in surfaces of objects for the up to days. This concludes that the study is also significant in giving awareness and proper knowledge to the public about proper management of hazardous waste in the province of Bataan.
Recommendations. This research can be an opportunity to encourage Bataan to finally pay attention to better waste segregation, disposal, recycling, collection, and storage of this kind of waste. Possible updating and replanning of the Bataan 10-year solid waste management plan made in 2017 after the unforeseeable pandemic came into the scene. This section is pure suggestion for sustainable and more suited waste management plan for the province of Bataan during the pandemic. Bataan currently follows the no segregation, no collection policy, but only applies with the biodegradable and non-biodegradable segregation. Now that hazard wastes are rampant and can be seen in each household, reasonable suggestion is to add a yellow trash bin or separate hazard bins in each household for easy collection. Awareness should be spread that improperly disposing of the hazardous waste may be also charged with violation of Republic Act 6969 or an act to control toxic substances and hazardous and nuclear waste and may also be fined. Since Bataan have a systematic scheduled collection and transfer of municipal waste, average of 3 to 4 times collection per week, alternately picking up biodegradable and non-biodegradable from each household, it is possible to add hazard waste collection on the schedule too. Once in a week would be helpful enough to collect hazardous waste that is generated in each household during the pandemic. And that is all for our report. This is the Ben and Best Group. Thank you.